This is a brief overview of shockwave therapy for anyone who's thinking of adding shockwave to their practice. We'll cover the different types of shockwave machines that are available, as well as the technology, the cost of each device, and their application in clinical practice. My name's Stuart Turner. I'm the owner of Ultrana Medical, and we're the distributor of Medispec shockwave devices. As well as being a medical device distributor, I'm also a physiotherapist, and I've used shockwave in clinical practice, both focus shockwave and radial shockwave, for many years. We'll start with a brief history of shockwave. So it started in the 60s and 70s with the first experiments of the biological effects of shockwave on human tissue. By the 1980s, they were already using large focused shockwave machines to help break down kidney stones. And that's a picture of one of the early shockwave machines up the top, where the patient basically had to sit in a bathtub of water, and the shockwaves would go through the water and into the tissue, and they were basically strong enough to break down kidney stones. In the 1990s, they started to do more studies about the musculoskeletal applications of shockwave, and a lot of that came from the fact that originally there was a lot of concern that if they could break down kidney stones, maybe they could also break down bone. But what they actually found was that there were some beneficial effects in tendon, also in bone, and they were able to cause new blood vessel growth too. By the 2000s, they'd invented radial shockwave. So radial shockwave and focus shockwave are slightly different technologies, and we'll talk a little bit more about that later. But essentially what they're able to do within the 2000s is shrink the size of the machines down. They were able to make them more economical, both focused and radial, and a lot more research started to be published on musculoskeletal conditions for not only focus shockwave but radial shockwave too. And the development of a lot of protocols came about, which helps us to understand how many sessions a patient would need to get better from different types of conditions. So the two main types of shockwave, we have focus shockwave there on the left, radial shockwave on the right. Focus shockwave is the original type of shockwave and what some people would still call true shockwave. They are typically far more expensive than radial shockwave, so you could end up paying 2 to 3 times more for a focus shockwave device than a radial shockwave device. And the radial shockwave device, on the other hand, tend to be a little bit more economical, a little bit smaller in size, and they are becoming much more common in musculoskeletal practice. So the physical differences between the focused and radial shockwaves are this. The waveform of the focused shockwave is focused to a point. Now, I think that the term focused can actually be a little bit misleading because the size of the focal zone can actually be much larger in focused shockwave than it is in radial shockwave. So I'll talk more about that in a moment, but focused shockwave, focused wave, radial is an unfocused wave. The maximum energy of the focused shockwave is at the focal point. That could be 5, 6, 7, 10 centimeters into the tissue, whereas radial shockwave, the maximal energy is always delivered on the surface closest to the skin and then lessens as it goes through the body. The mechanical effect, highest pressure at the therapeutic area for focus shockwave, and radial shockwave, obviously it decreases as you go lower. Now the peak pressure and the force of a focus shockwave in all machines from all manufacturers is always larger than for radial shockwave. Now the interesting thing about this is that we usually consider in musculoskeletal medicine a 5 megapascal pressure to have a therapeutic effect. So both focused and radial shockwave can achieve this. The pulse wave of a focus shockwave is 1,000 times shorter than a radial shockwave. And what all of this ends up meaning is that you can usually achieve more or within less treatments with a focus shockwave than you can with a radial shockwave. Now there are other differences as well that I'll talk about in a moment, but let's just take a quick look at the physical shockwave. So on the left we see the focus shockwave, on the right we see the radial shockwave. We get a far quicker and greater peak pressure with a focus shockwave, and we also get a quick negative pressure at the end, which causes more cavitation in the tissues, which basically increases the cell's permeability. Now, if we look at the diagrams of the different pressure waves at the bottom, we can see that the focus shockwave, we get the pressure increasing to a certain point deep within the tissue. whereas the radial starts off with a lot of pressure and decreases over time. So you may see this graph sometimes with focused shock waves versus radial pressure waves. Also, I'll just mention this, some people will call them radial pressure waves or radial pressure therapy, for example, because they may consider that it's not a true shock wave. Regardless, with this graph here, one thing I'd like to point out is that, in fact, although the scale of the pressure may be correct on the graph, the time interval between the focused shock wave and a radial shock wave is actually much, much greater. So what does it mean from a clinical perspective? Well, the really good news is that you can achieve good clinical effects for most musculoskeletal conditions with either radial or focused shock wave. So both will actually create good effects. The main difference between the two is that with focused shock wave, you have the ability to treat at far deeper depths. With radial shock wave, we're talking about usually treating things which are 1 to 3 centimeters below the skin surface, which, for a lot of things, patellar tendinopathy, plantar fasciitis, most tendinopathies, in fact, they tend to be fairly close to the skin surface and we get a good treatment effect for them. So if we look at the list on the left here, orthopedic conditions, most of these we can treat with either focused or we can treat it with radial shockwave. The big difference between the two is that if we're looking for things which are far deeper, so perhaps a proximal hamstring tendinopathy, we would definitely need to use the focused shockwave. The other thing that the focused shockwave is able to do with this greater pressure is break down calcifications far easier. And we also get more neovascularization. So for erectile dysfunction, for example, men's health physiotherapy, we will be able to use focused shockwave to improve vascular erectile dysfunction and to treat chronic pelvic pain as well, because it's a deeper structure, whereas radial shockwave is unlikely to be able to give us those benefits. And in fact, there's no studies that show that radial shockwave works well for erectile dysfunction or chronic pelvic pain. I would add to that vascular angiogenesis too, so for wound healing, and also in some cases for fracture healing too. So just a brief overview of the different types of focused shockwave. So there is a huge amount of difference between different shockwave machines that are out there on the market, and that's because they all use different energy sources to create their shockwaves, which means that the size of the shockwave and the cost of the machine is different for each of them. So at the top we have electrohydraulic shockwave. So that's the traditional shockwave. It was the earliest focused shockwave. It basically creates the largest shockwave and the largest treatment zone. So this is where I say that the term focus can be quite misleading, because when I think of the term focused, I think of something small. Whereas with focused shockwave, you can actually get a huge focal zone, or a huge treatment zone, as I prefer to call it. And so this is what we get with electrohydraulic. The downside of electrohydraulic shockwaves is they tend to be more expensive, and you need to replace the heads more frequently than you do with electromagnetic or piezoelectric. So electromagnetic, as the name suggests, the shockwave comes from electromagnetic energy, and piezoelectric, much like ultrasound, uses piezoelectric crystals. They tend to be the smallest shockwaves, smallest focal shockwaves, but they tend to be less expensive over a long period of time. Similarly, there are different types of radial shockwaves. Probably the most common is the compressed air. Compressed air, they use an air compressor to fire a bullet within a gun, and that compressed air is able to fire the bullet down a gun to the end where that shockwave is then transmitted into the tissues. Now, we always use a little bit of ultrasound gel, whether it's focused shockwave or radial shockwave, so that's replaced those big baths that people used to sit into. With Medispec, they use electromagnetic. Now, my experience using both of the different types of devices, and in fact all radial machines, I'll say this, they all get a very good treatment effect. I found that the electromagnetic is quieter and requires less maintenance than having an air compressor, because there's less moving parts and you still get a very nice treatment effect. I would say for any of the radial shockwave machines on the market, if you can do a bit of a search and you find that they've got some studies that validate their particular machine, then they are probably going to be a very good machine for the clinic, no matter which brand you choose. So the reason I say that is because even though on these machines you could see a certain number of millijoules if you're looking at electromagnetic, or you could see a certain level of bars if you're looking at compressed air type of shockwave machines. There's a lot that happens between the generation of that air pressure and that shockwave traveling into the tissue, so the design of the handpiece, the design of the bullet, for example. And what we find in practice is that even though you may be getting 5 bars at the air compressor or 180 millijoules at the electromagnetic source, that doesn't always translate into energy into tissue. So I think if you're choosing a radial shockwave, my honest opinion is that most of the good brands are going to give you a very good treatment result, but pick something that has some research behind it. Pick something where they've done some studies and have validated their actual device, and don't just go off the specs. So I mentioned briefly about the large focal zone. I won't go into too much detail with this, but this is for focus shockwave machines only. So focus shockwave machines, a typical focus shockwave machine may only have a focal zone of about 3 centimeters long by maybe half a centimeter wide. So that causes problems, especially as you're going deeper into tissue. You need to aim the shockwave device very well. You may need to use imaging to guide you. What I like about the OrthoSpec with its large focal zone, it's almost 5 centimeters wide. It penetrates 13 centimeters deep. So for most structures within the body, you can do that without imaging, and you can be confident that you're getting a good treatment effect, no matter, to a certain extent where you're aiming that focus shockwave probe. So this is what the two look like. Focus shockwave at the top here, we're getting the energy focused into an area. At the bottom we have the radial shockwave head, and we're getting the area dispersed out over a smaller area. So that's essentially the differences in terms of the focal and the radial shockwave. I hope that helps, but if you have any questions at all about shockwave, please feel free to either send me an email or give me a call, and I'll be happy to answer any of them. Thank you.